Human Resources and Labor Relations Committee meeting to order, and ask Kayla, could you please take a roll call?
Trustee Flood,
Here.
trustee Michaud,
Here.
trustee McMahon,
Here.
trustee Loring,
Here.
trustee Eames,
Here.
and trustee Riley.
Here.
Thank you. I guess I would just like to remind people to leave their mics muted when not speaking. And first order of business would be to go into executive session. And could I have a motion for the HR and LR Committee of the Board of Trustees to go into executive session under the provisions of 1 MRSA Section 4056A to discuss the evaluation of personnel and the consideration and discussion of appointments, evaluations, employment, and duties, and 1 MRSA Section 4056D to discuss planning for negotiations and communications with AFUM, UMPSA, ACSUM, Police, PATFA, and Service and Maintenance Units.
So moved.
Second.
Thank you. Kayla, could you take a roll call vote?
Trustee Flood,
Yes.
trustee Michaud,
Yes.
trustee McMahon,
Yes.
trustee Loring,
Yes.
trustee Eames,
Yes.
and trustee Riley. All right, motion carries.
Thank you. And we're headed to executive session.
All right, I believe we are all here.
Well, thank you. I'd like to call to order the public session of the Human Resource and Labor Relations Committee meeting. And I thank everyone for being here. And I'd like to introduce the first item as the Employee Health Plan Task Force. It's a scorecard, and we have the Senior Director of Health and Benefits for Willis Towers Watson, Denise Stevenson, is going to give us an update on that. Welcome, Denise.
Good morning or good afternoon, everyone. Appreciate the opportunity to join you. Can everyone hear me okay? Okay. I'm sharing my screen. Just by way of background, my name is Denise Stevenson. I've been working with WTW for upwards of 27 years. It's been an honor and privilege to partner with the University of Maine system. I've been working with the organization since 1996 in the management of your health and welfare benefit programs. This scorecard, I have been invited at several sessions, is a compilation of a work that we do together with the Employee Health Plan Task Force. So by way of background, the Employee Health Plan Task Force, IFTIF, it was created back in 2010 as a result of the Affordable Care Act. It's a multi-stakeholder group. We've been meeting monthly. We have members from the executive team, from campus leadership, finance, HR, representation from all of the bargaining units, and then also some sort of salaried, non-unionized folks come together each and every month to sort of discuss how to best, we refer to it as bend the trend and look for ways to mitigate healthcare costs, which we know are escalating. IFTIF has an established charter, and we have sort of four, what I would call the primary pillars of work. We look a lot at our health plan network to make sure that folks are using the plan wisely and seeking care from network providers. We look at the plan design. We try to target features to drive positive utilization, sort of a very scalpeled approach to plan design. We spend a fair amount of time talking about well-being and are we offering programs to support our workforce, and how do we encourage folks to engage in that type of activity? And lastly, talk about the importance of communication, obviously, as awareness increases, appreciation increases. I will say that IFTIF, it's not a forum for bargaining. It's truly valuable in that it's a safe space for folks to come together and develop sort of common language, common understanding, a common data set, so that that information can be used, I would say, to help inform decision making. And we have really good attendance and very strong engagement. I will say all of the members have a voice and are not hesitant to express their ideas or their feedback or offer improvements for programming. So this scorecard, we developed this to say, you know, obviously the goal is sort of to bend the trend and have a positive impact on healthcare costs. It's a little bit like swimming upstream, and in particular, in our most current period, healthcare costs are as high as we've seen in over a decade. And you can see over the course of the last, I think this is a 10-year chart, you can see sort of the healthcare cost line obviously increasing each and every year. The yellow line illustrates sort of if we were to do nothing, what national trends look like. And then the purple line right below that, the dark purple line, is your actual claims costs PM stands for per member per month. So for every belly button, we call them belly button, for every employee, spouse, or child that's a member, for every member on the plan, on average, what is their per member per month costs? You can see over the course of the last 10 years, costs have nearly doubled, but you have outperformed inflation. The trend line has consistently increased, I will tell you, with the exception of, you can see in 2020, this was the COVID period where we had sort of the closing down of the healthcare system for a period of time. People weren't able to access the system as COVID really sort of pushed care out. So you can see sort of that depression in 2020 with the closure of the healthcare system, and then the subsequent surge in utilization after the pandemic. I'm not hearing any questions, so I'm going to just pause. The network management. So again, this is one of our core pillars. We measure to make sure that the employees are using in-network providers. And again, Cigna is our healthcare partner, has been over the course of IFTIF. And the University of Maine system, there's very strong utilization of the network. We also look to make sure that individuals in more rural parts of the state have as strong of network access as those sort of in the more populated areas. We also look to make sure that we've got good usage of primary care providers. Again, a primary care physician is usually a more cost-effective point of care than, say, a specialist. So we want to make sure that we are using primary care physicians to the extent they are available. Cigna does have what they call their Cigna Care designated, they go by CCD providers. They do identify sort of the top performing providers, and if these individuals meet certain quality standards and provide that quality care in a cost-effective measure, they're deemed as sort of a tier 1 or a CCD provider. We like to encourage people to use and seek out those types of providers. And then on the hospital side, Cigna has a certain type of contract with hospitals, and those hospitals are held accountable again to quality and total global cost targets. And we look to see that a certain percentage of the population, again, is seeking care from hospital systems who are contracted in that manner. Under plan management, again, a lot of the plan design changes that we talk about, we want to encourage people to use all the various, there's multiple points of access for care, and we want to make sure that people are using the plan wisely. So emergency room visits, a little slippage actually here. It's interesting. I would say about 6 years ago, we were well above the Cigna norms and had done a nice job sort of encouraging people to stay out of the emergency room and use sort of urgent care or minute clinic types of settings. Obviously, in the pandemic, the 2020 plan year, nobody wanted to go to the emergency room, and visits per thousand were probably as low as we had ever seen. We're seeing some creepage back up into individuals using the emergency rooms. I think some of that, this is anecdotal, is probably it's been difficult, right? As we've seen this sort of post-pandemic surge of the healthcare system. Sometimes it's hard to get an appointment in a timely manner. And so folks might be pushed to the ER now just because of sort of the bottleneck, if you will, and sort of the more appropriate areas of care. We do try to encourage people to use telehealth where we can. We have made some plan design changes. We waived copays, for example, for folks who are able to use telehealth. And we also do encourage, again, on the pharmacy side, the use of generics. The copays are structured in such a way that we're encouraging generic utilization. Again, you've always had, I would say, best in class usage of generic drugs. Mail order and Retail 90 is a little unique in Maine because of your mail match program. And then an area of opportunity is our members using the EAP. Again, there's a huge need for mental health, and mental health resources are pretty stretched, and trying to encourage people to consider using the EAP. Again, there's no cost to the members who access the EAP for short-term therapy. And obviously, when people use the EAP, that's sort of a more capitated financial model, and it keeps the claims out of the health plan. But 3.5% again is probably as low as it's been, and given sort of the challenges, this is a real opportunity for improvement. In the wellness space, we do have the University of Maine system does have a very formal wellness program. So we have something called level 1, and we have something called level 2. And level 1, is if individuals get a primary care appointment, or if they engage with a health coach, they earn what we call the level 1 incentive, which is a differential off of their health plan premium. So employees do, if they complete level 1, they have a lower contribution than those who choose not to participate in level 1. They pay a higher payroll contribution. And you can see pretty consistently, again, a little bit of a lull in 2020, where there were challenges getting in to see health providers. But historically, the participation in level 1 is about 90%, and that's been very consistent. And then level 2, once you complete level 1, you're able to participate in level 2, which is a series of campus-based events, sort of fun challenges or classes. And once you complete level 2, you can qualify for sort of a cash, if you will, incentive at the end of every year. For those who complete level 1, again, you have a choice between seeing your primary care physician or engaging with a health coach. And you can see the number of folks who choose the latter, that prefer to have sort of a dialogue with a health coach on a lifestyle challenge. Communications, you've seen some sort of, I would say, some erosion of success, I guess, in some of these metrics in 22. I will say that in 2020 and in 2021, we did have a dedicated resource, a communications expert, if you will, subject matter expert, that was sort of dedicated to helping us get the message out. There was a series of newsletters called Healthy in Maine. We've since lost that resource and have not had sort of a ongoing cadence of being able to communicate programming to employees. I think that there's some initiatives being done out of HR, but it's being done sort of some at the system level, some at the campus level. We've sort of lost the ability to measure it through IFTIF. And so I'm hoping that as we move forward, that there's resources re-granted to IFTIF so that we can continue to help educate the community and the membership about the benefits offered by the University of Maine system. And then lastly, or not lastly, almost sort of this health improvement, sort of, are we engaging people? Some very strong statistics here on the University of Maine system, because we do have our level 1 incentives, because we do have an engaged workforce. We always have had very strong engagement in things like preventive care screenings, and with having people get their personal screenings, whether they be mammograms or colon cancer screenings, have consistently outperformed the norms. And then the last two, gaps in care, indicates, so if there is a best practice for treating a certain chronic condition, if someone has no gaps in care, they're at 100%. And if they have strong gaps in care, they're up in the 80s. So you can see that most people, a good example would be a diabetic, right? Someone who has diabetes, they have to take their insulin, they have to have their eyes checked, they have to have their feet checked. If they're getting all of those steps done, they have no gaps in care. So this is a very strong metric. And medication adherence, again, a little slippage here in 22, but for those folks who are being prescribed an ongoing medication to help best manage their chronic disease states, we want to make sure that they're taking their medication on a consistent basis and that they're not lapsing their therapy. And then overall, this gives you a feel. We do have a predictive model, and we're able to look at the algorithms and sort of the claims utilization patterns in aggregate. And you can see sort of the average age has been pretty consistent over the last 3 years. And I would say age being a strong predictor of health status and cost, very stable across the board as to what percentage of the employee base is sort of considered low risk versus medium or high risk. So that is our scorecard. Any questions?
I didn't have a question on the scorecard itself, but as far as the health plan task force, what is the funding for that? How does that get pulled together? Is that the insurance company helping to pull that together? Is that all funding coming from the university system? I just am kind of ignorant on that. I just wondered how that gets pulled together.
Yeah, so the Employee Health Plan Task Force is, it's primarily done virtually. So we meet, I would say, once a month via Zoom, similar to this forum. And Willis Towers Watson, we put together the agenda with input from the committee members each and every month. And then it's more of a dialogue. I don't know if that answers your question.
No, is there a direct cost to the university system to make this health plan task force function, or is it just I don't know how that works. That's my question. How do we make it work? Who's driving it?
So Willis Towers Watson, we are your health and welfare broker for your various lines of coverage. But many years ago, we agreed that we would help support the University of Maine system in managing this task force, and we do not charge for that. It's in our contracts specifically that this is sort of a gift that we give to the university system because we believe it is in your best interest. We want to be a good business partner there. So other than that, it's people's time,
right,
away from their jobs.
And that answers it perfectly for me. Thank you. I just wasn't aware of that. So that's very helpful. Thanks.
And I assume, Pat, and I would know that faculty members who participate don't get release time for this, do they? Yeah.
Thank you, Denise. Any other questions? That's very interesting data. And if you've been doing it for as long as you have, you certainly are providing something to us that's very, very valuable. So thank you very much.
You're very welcome. Any other questions, or I can jump off, I suppose?
Sounds good. I guess we're ready to move on to other things. So thank you very much for your help today.
All right, enjoy everyone. Take care.
Thank you. Thanks. The next topic that we had was a labor relations update from our Senior Director of Employee and Labor Relations, Ria DeMay, and her associate, Senior Labor Relations Manager, Susan Cameron. So I'll turn it over to you, Ria.
Thank you and good afternoon, everyone. So I have three updates, general updates in the labor and employee relations space. The first is that the Graduate Student Union has been officially recognized at the University of Maine system. It was recognized by the Maine Labor Relations Board, and we are finalizing the bargaining team for negotiations. Those meetings start to happen this week, and our first initial conversations with the United Auto Workers, who is overseeing and assisting the Graduate Student Union. Our first meetings with them should be the end of this month, the very beginning of November. Any questions on that? Moving on to bargaining. So a few bargaining updates. The first is that we are in the mediation process with the Teamsters, which are service and maintenance. We're looking to have those mediation talks begin around the first or second week in November. We're working with outside counsel and we've selected a mediator. So that's going to be ongoing, and hopefully we'll work to a resolution for the collective bargaining agreement. The second is that we're in the same process with the police unit as well, that we are working toward mutual mediation, and we'll be scheduling those in November as well, and working with the mediator to try to find a resolution to settle the collective bargaining agreements. And then for the part-time faculty unit, we have reached agreement at this point for the collective bargaining agreement, but we're waiting for them to officially have it signed off by their membership, and then that tentative agreement will then be submitted to the Board of Trustees for your approval as well, as soon as we get the green light. That's it for bargaining. Any questions on that? And the last update is on distance education. That's been an ongoing item for the Board of Trustees. And so we are still at fact finding. This has been scheduled, rescheduled, and now we're at the point that we should be having our fact finding hearing in December to address the distance education payments.
Thank you.
That's it for us. Thank you.
I don't see anybody's hand raised for any questions. So, Ria, I guess that is good. Well, thank you very, very much to both of you.
Thank you all.
Thank you very much. And Vice Chancellor Dorsey, you had a couple of topics you wanted to update us with, first being the search for a human resource officer. Is that correct?
Yes, thank you.
Thank you.
Before I do, I would just like to say quickly, so I think most folks around the screen have worked with Katie. I mentioned earlier that she is transitioning in her role, that she has recently accepted a role within our HR area of EO project specialist. So moving from a more general area under the CHRO to an area in our within the area that we have under HR and institutional, what is the new term? Institutional inclusivity, I think. Equity, correct, equity. So she has just recently started, but she's been very gracious in still working with us and providing support to us while we're working on our two searches that I will give you an update on now. But also, in addition, I wanted to welcome Jason Talbert, because I don't know that people have met Jason. Jason has been with the system for a bit. He was leading HR efforts at the University of Maine at Presque Isle. And I would say, what, Jason's 8 months ago?
I actually, next month will be 1 year. So started at Presque Isle last November.
Okay, there. So we transitioned him from working at UMPI to our system level HR office, where he is the Senior Director of HR Operations and has been doing incredible work working on our payroll and benefits and a lot of the different areas that we are looking at restructuring and revising. And he's been an incredible leader on that team. So I had asked him to join us today. So I wanted to do a very quick introduction. But to move into the two searches I wanted to highlight today, as you are probably familiar, we are currently searching for a CHRO, a Chief Human Resource Officer. The search, it has been published for 2 weeks now, I think. The committee is being formed and applications are under review. And I'm pleased to say we're having great results. We've had great response to that ad, and we are reviewing them now and looking forward, hopefully, to even seeing more applications come forward. But I'll have a more formal update on that when we meet again. But very positive, a very positive update on the CHRO search. And as I mentioned, Katie's transition to a different position. She, in moving over to the EO area, has left the Special Assistant to the Human Resource Area position vacant, and she's working with me now to help staff a committee and get that up and running so that we can also search for her replacement. So those are the two HR related searches that I wanted to give a quick update on today. And I will just continue on through if that's okay with you, Chair Flynn. Okay. Next, perfect. As part of the packet today, you received just an image of our updated UMS HR organizational structure. And it has been through a few different iterations. So we wanted to make sure, even though this group has seen something similar to it in previous meetings, we wanted to include an updated version in your packet today, just simply because we have made a few slight revisions to it, but wanted to just again note that the changes that we've made to go from a very incredibly flat organizational structure to one that has a CHRO with 3 senior leads reporting to the CHRO, and then underneath each of those leads, different various system or campus-based folks that are doing particular functions within HR. And this particular model has received great feedback. I think will be a very positive one for the new CHRO to move into. And we're sort of getting everyone aligned in their new spots now. So just really pleased to have this new structure. It is in your packets. I didn't plan on pulling it up today, but if you wanted me to for any reason, we could answer any questions that you may have. But it is it's met with some really great feedback from those in HR and also the offices that work closely with the HR team. My next is a very quick update on our procedures and the development of APLs for our recruitment processes. We, as you know, had gone through a review of all of the recruitment and hiring practices at the campus-based and across the system. And then from that came a list of recommendations for revision to the current practices, addition of some areas that really could be added to make sure that we were had a robust practices and that we were in fact following all of the best practices, regulations, laws, and doing that consistently across the system and across our universities. That review was completed a few months ago, and now we've worked with an HR leader who has been hired as a consultant to take those updates and revisions and convert them to an APL or an administrative practice letter. So they are public facing and they follow the same format that other procedures and practices across the system are developed, written, and housed in that same particular way. So that work is ongoing. It's coming along very well. And the anticipated end date for that first piece of it was the end of the year, December of 2023, and it is on track for completion. So nothing out of the ordinary to report there. My last update, I believe, is the fact I wanted to just let you know that I have been in touch with Dr. LaLiberty. He is submitting all of the materials that are required for our contract with him that relate to his employment search, and he is up to date on all of the requirements from the contract, and those materials are available for your review also. So if there is Any questions on any of the quick updates I just gave? Happy to answer them. I know I just sort of went through, so happy to go back to any one of them if you have a question or comment.
I don't see hands raised, but I don't want to cut anybody off though either. I don't see that. Were there any other topics that someone felt was important to bring up today? I don't see that either. I just want to say thank you to the leaders who do all the work behind the scenes and on these calls for us. Acting Vice Chancellor Dorsey and Senior Director Ria DeMay. It's a lot of work that you do in the meantime that we know that we rely on it, and we're very thankful for you. And I also want to say welcome to Jason to being a new member who will probably show up on these calls quite a bit. So I didn't have any other topics that I felt that we needed to go through today. If everybody feels like they're done, we would call for an adjournment of our meeting. How's that sound? Sound good? Okay. With that, I guess the meeting is adjourned. Thank you very much, everyone.
Thank you, Pat.